There are multiple things that affect testosterone levels in males. It is said in the literature that testosterone decreases 1% per year after 40. In my clinical experience, it starts going down a lot earlier, and it starts going down a bit harder than just 1%. The reason for that is psychotropic medications that people are using today to treat different problems like depression, anxiety, and other psychiatric illnesses. There's also medications for other conditions. There's the things that are added to food. We have a lot of hormones and chemicals, antibiotics that are given to cattle, to poultry, and to pork. And these things, we don't know exactly what the effect is in our bodies. So this is affecting our testosterone levels. Now, when we're having symptoms about the testosterone being low, loss of libido, loss of losing the spark of life, difficulty concentrating, increased body fat, also decreasing the hardness of the erections, then we probably are suffering from a low testosterone. The first thing that we need to do is find a testosterone replacement clinic or a functional medicine physician that can help you out with those. There are certain benefits to the use of testosterone. One of the most important that I see is actually improve in the glycemic control. For us today, control of the glycemia, it's an important deal. We're living in a society that it's directed to instant gratification. So us, instead of pursuing a complex, more expensive diet, we stop at fast foods for food. What's this doing is actually it's increasing the prevalence or the incidence of obesity in our society. With time, you see that in the past, being overweight, it was something that we've seen some people. Today, it's more and more of our population, it's overweight. In my culture, it is accepted that after a certain time, you will grow a belly. That is metabolic syndrome. So testosterone will help us control glycemia, which it will indeed also help us lose fat and put that metabolic syndrome at bay. But this is not the only thing. It improves the libido, it improves our sexual function. It can better our memory or cognition. It can help with bone density, and it will lower the BMI. That's the basal metabolic index. So those are some of the benefits of doing testosterone replacement therapy. It's important to always know that when we're treating young patients or patients that even they're hypogonadal or they're testosterone deficient, but they want to maintain fertility, then there are medications that we can use that will increase the sperm count or increase the luteinizing hormone. There are selective estrogen receptor modulators that can help in this endeavor. There are also aromatase inhibitors. Aromatase inhibitors are of my particular interest because I have a lot of people in my community that are overweight, and many times when we start a hormone replacement therapy, especially testosterone in males that are overweight or that have more than 20% body fat, that body fat is rich in aromatase. Aromatase will change testosterone to estrogen, which is the primary source of estrogen in males, is testosterone. So if we don't control this aromatase activity, the therapy that we're doing is actually going to be detrimental to that individual, because that testosterone will be changed into estrogen, which will turn into estrone, and that's linked to multiple diseases. So that's not something that we want to happen. When we're dealing with this type of patients, there are certain steps that we need to follow. Not only should testosterone, if testosterone or injecting testosterone is the only way we have for testosterone replacement therapy, then we might have a suboptimal program, and we need to add more things like natural supplements, dietary modifications, and the medications like I mentioned before, like the aromatase inhibitors and the selective estrogen receptor modulators. Selective endocrine estrogen receptor modulators can become easily the mainstay or the drug of choices when we're dealing with male patients that want to maintain fertility.